Hey there, I'm Dr. Erin Bowe. I'm a clinical and perinatal psychologist. I'm the author of 2 books. I'm a course creator. I do lots of things. I'm also a mum of 2. So I thought I'd make a short little intro video because even though you can read about me on my website, it's sometimes nice to connect a face and a voice. So I thought that might be useful, and I haven't done one of these for a little while. So what do you want to know about me? Probably if you're coming to me for therapy, it might be helpful to know that my experience, my personal experience, I suppose, ranges between things like having hyperemesis. I had really difficult pregnancies with my 2 girls. So I know what it's like to throw up all day, every day and feel like it's a struggle. I've had 2 traumatic births as well, which inspired that book up there. I've also got a couple of courses teaching people about birth trauma. One of them is birth trauma training for birth workers, where I teach midwives and doulas and obstetricians and all sorts of people about how to make birth better. And I like these days to use a combination of things. So it might be that you're coming to me for a birth trauma debrief, which will suit plenty of people. But for some people you might need a bit more than that. And so if we're looking at processing trauma and actually really coping and managing those memories and those experiences, I might use something called EMDR, eye movement desensitization and reprocessing. I use a little bit of CBT, cognitive behavior therapy, all the alphabet soup of acronyms. My approach is very much one that's based on compassion and humour and finding really practical tools that people can use to actually get through the day. So we'll come up with something that's kind of suits you and your personality and your life, rather than kind of something really super formulaic. I like EMDR because it actually works, it's helpful, and it generally works quite quickly. So that's something we can discuss if you're interested in that. Also anxiety, depression, burnout, any of this sort of stuff that is just stressful and hard to manage about mum life. My 2 kids still are in some ways really not great sleepers, so that's something else I can understand. I also help people with things like pregnancy loss in whatever form that takes. It might be useful for you to know that I'm done having babies, so you're not going to come across a practitioner who's pregnant at any stage now, if that's helpful. I used to be a childbirth educator, so I used to teach hypnobirthing with Hypnobirthing Australia, so I've got a wealth of experience to add there in terms of hypnosis and preparing for positive birth and that kind of thing. And if you've come along for potentially business mentoring or supervision, I've been a psychologist for 14 years. I've been doing my own telehealth business for, about 8 years, I think. And along the way, I've built a bunch of passive income, so things that I do when I'm not seeing clients. So that's an interest area of mine as well, helping people to figure out how they're going to make income and make impact, particularly making big global impact, like reaching people outside of your consulting room and into 45 countries is what I teach in, for example. So to really get your message out there into the world and have more time to do things that's enjoyable and fun, and to overall make sure that you don't burn out. I live in the countryside, so you're probably going to hear chickens in the background. When it's not freezing cold weather, I'm often outside working in my office pod. So I really value nature, slowness, having a good sense of humour, and just trying to be, as much as I possibly can, someone who is warm and down to earth and relatable, because those things are important to me. So hopefully this little intro video has helped you find out a little bit more about me. You can always email me and ask for more.